Hey guys, Dr. Beddoe here, physical therapist, and today I want to take some time to talk about your blood pressure. So, we all go into the doctor's office to get a checkup, and you guys see either a PA, a nurse, or someone come in, and we check the blood pressure. We got a blood pressure cuff, right? We put the blood pressure cuff on, just like so. Obviously a little bit harder to check it on yourself. But we pump it up. We can see the dial start to move up and down. Right? I'm going to listen in if I'm taking this on a patient. And we're going to go until I see the first little tick. So you can see it on me. You start to see the needle move. You're going to hear that when I listen to the stethoscope. And then you're going to listen for the last little beat. And that's going to tell me where my systolic is and where my diastolic blood pressure is. Now, what do those mean when we're looking at and we're checking on a patient? Well, we're looking for what the pressure is after the heartbeat. So I want you guys to think of this as a river that's flowing, right? So if it's really pressurized, it's the Grand Canyon, it's flowing at 25,000 cubic feet per minute, or cubic feet per second. It's going really fast, right? Way too high. That's going to be, 160, 180 when you're getting really like up into the high hypertensive stage 2, where it's really becoming a problem. Or it's going to be like a river in Kansas where it's flowing really slow. There's not enough pressure to be able to move that water. It's just kind of stagnant. We also don't want that either. So that's also why we're checking for blood pressure to see kind of where that's at. Because remember that your body and your vascular system is a closed system. At least it should be a closed system. And so it's going to be pressurized. So we don't want too much pressure. There's the most pressure. And the diastolic is when there's that lax time. And what's the pressure that's in the system in between, right? When there's not going to be fully pressurized. Because you don't want it to be too low, because we need to have some pressure in the system to be able to keep that blood flow moving. Things that we look for, obviously, are going to be high blood pressure or too low blood pressure. If it's too high, especially in older individuals that have a weaker vascular structure, maybe they have a past medical history with some heart issues, some heart failure, we really want to monitor that. We really want to, at least for my profession, I want to be able to get in touch with the physician. Maybe the physician can prescribe them some different medication, adjust the medication they're currently taking, or make some changes there. If it's too low, same thing. Maybe we need to tweak. Maybe the physician needs to tweak the medication a little bit more to be able to help them out. But what can you guys do without having to have different medications? If you're on medications, what can you guys still do to be able to try to lower that blood pressure? So some things that can definitely affect your blood pressure are things like alcohol consumption can increase your blood pressure. Things like smoking. If you guys stop smoking, it can help to lower that blood pressure. Obviously, salt intake can increase it. That's going to be variable depending on who you are and what kind of diet you're already having. Things like exercise are going to be able to reduce that. Losing some weight is going to be able to reduce that blood pressure overall. Because when we do exercise, our blood pressure increases. That is okay. We're just not wanting to have our resting blood pressure be very high over the long period of time and putting that much pressure on our vascular structures in our body. Because if you put that much pressure on it for an extended period of time, a long period of time, day in and day out, that's when we are really concerned about patients, having a stroke. People that maybe have different vascular abnormalities in their brain can lead to aneurysms when the blood pressure is too high. So we really want to monitor that and be able to try to reduce that a little bit and just be more effective overall. So try to reduce it with those things that I mentioned. Just being healthier overall can definitely help to reduce it by adjusting your diets. And let me know if you guys have any questions. You guys can comment in the comment section below. I'll be more than happy to get back to you. Have a good rest of your day.